Dr. Bebout here. Let's do our medical term of the day. And today I want to talk about something called the Ottawa ankle rules. The Ottawa ankle rules were developed in about 1992 to help physicians make determinations on when someone with an injured ankle needs to actually have an x-ray. You don't have to x-ray everybody. And some people think that x-rays fix things. X-rays do not fix anything. X-rays guide you in how to fix things, and x-rays can actually be detrimental due to radiation exposure when it's unnecessary. But anyway, the Ottawa ankle rules focus on the ankle and in people that twist their ankle or roll their foot over. There are some specific guidelines on how to determine whether it's a significant enough injury to warrant an x-ray of that. The Ottawa ankle rules are very good at determining whether a fracture actually has occurred. And if you have negative on the Ottawa ankle rules, it's very unlikely that you have a fracture, thus it's unnecessary to get an x-ray. So I'm going to try to point out what they mean exactly. One of the Ottawa ankle rules is let's see if I can get where you can see my ankle. If you have pain in the distal, say 6 centimeters of the fibula, which is right here, down to the point of the ankle bone. If that is point tender when you press on it, get an x-ray. The other side is the medial malleolus, the other medial ankle bone. And if you are tender in the distal 6 centimeters or so of the posterior part of the tibia down to the tip of the ankle bone, then that's a positive, get an x-ray. Now, right here, you have your 5th toe, your pinky. It attaches to the 5th metatarsal. And then that bone comes down and ends about right here. That's the head of the 5th metatarsal. If you're tender over the 5th metatarsal right there, get an x-ray. Now the hardest one is the navicular bone, which is one of your ankle bones here in the anterior part of your ankle, right in front of the talus, which is where the tibia sits down to form your ankle and your foot. If you're tender over the talus or the navicular, that's what warrants an x-ray. Also, you can look at bruising, severe bruising, and that kind of thing. Or if there's an inability to take 4 steps at the time of the injury or at the time of evaluation. So those are some pretty concrete guidelines that you can go by. And if none of these are positive, don't expose them to radiation. So there you have an explanation of the Ottawa ankle rules.